The health of our communities and of women who make up half our community is dependent on a variety of social determinant factors. Factors like the economy, our housing, our safety, job security, access to education, and affordable, healthy foods. Healthcare economist Jane Sarasohn-Kahn and Maven Clinic Sonia Milsom come together in this fireside chat to discuss the forces shaping women's health in a post-pandemic world and how we, collectively, can work to ensure the health of everyone in our communities.
Well, I'm delighted to be in a fireside chat with Sonia today from the Maven Clinic, and we're going to brainstorm and riff on women's health in a post-pandemic world, something we both live in as women, in and outside the pandemic and in our work lives. So I think you and I will have a lot to chat about here in our girl woman talk. So first, let's start on the personal level, Sonia. I mean, how did you enter the pandemic thinking about your womanhood, your woman's work, and then entering the pandemic? What's been your personal experience that sets sort of the context for what we're going to talk about?
Yeah, absolutely. Thank you. First of all, I just wanted to say thank you. I'm so thrilled to be here with you today and really appreciate bringing this to the forefront for our audience and really being thoughtful around it and just having a real conversation, right? You see so much data, and I know that's your area of expertise. So I would love to hear a lot of that from you as well as we have this conversation. But just to be able to, roll up our sleeves and think a little bit about it and talk about the things that we really need to change, I think, in the industry. And I love to think about the personal aspects and what drives all of us, right? That's what brings our passions forward. And mine really actually started many years ago. I started my career in maternal child health as a maternal child health Peace Corps volunteer in Morocco. I lived there for 2.5 years with no running water and really saw firsthand how the impact of a delivery system can have on the outcomes of maternal and child health and really the input on a family from a generational perspective. I actually got the chance to assist in 27 births and got the chance to see how, unfortunately, not all of them survived because you could see really the impact of that delivery system. And it's really what brought me to have a passion around women's health and how we can do things differently here in our country. I'm also a mom, and I went through my own journey with my two daughters who are 19 and 16, and I'm very thankful for. But candidly had, multiple miscarriages. My oldest was breech, and I had to go through a process of thinking about, how do you go through an ECV, and the traditional healthcare system really didn't help me, honestly. It didn't provide a lot of support. You get your normal visit in a couple of minutes, but finding the resources that we need was really challenging. And then ultimately had a safe delivery there, an emergency C-section as it ended up, and with my second, thinking about a VBAC and what were the right choices there. And again, trying to find the right resources. And all of this while I was working full time and traveling and, candidly in a world where predominantly male workforce area who, didn't always have the ability to kind of talk openly about what was happening on the day-to-day life while I was trying to drive my career aspirations and deliver on the things that I need to do every day. And so constantly balancing those things really, I think, has been brought to the forefront for the pandemic and what we're dealing with now. And as we're thinking about people every day and the choices that they're making. So that's my story, but I would actually love to hear yours as well.
I'm fascinated that you go from this Morocco experience from a developing country, looking at poor infant mortality, maternal issues, maternal sickness and mortality issues, morbidity. And then you come back to fast forward to our first world country. And you have this sort of crappy experience in in the richest country in the world. So we have so much we can learn from other worlds and other planes, and you've been informed by this experience. So here you are at Maven, and how lucky they are to have you full circle. It's fascinating to me. So as I was thinking about the pre-pandemic and coming into it, I've been a home-based worker for over 20 years. I started a home office before we had an open internet, before we had cell phones, and we had those slimy fax machines. And Staples, the office supply company, was my best friend. So I came into the pandemic in a hashtag work from home WFH environment anyway. I'm sort of the OG of telework. And then all of a sudden, everybody's calling me, how do we do this? And I couldn't do my normal workflow, life flow, which was in the middle of the day, run to my fishmonger or my greengrocer, take my walk to the store, which was my normal life flow to keep me sane while I'm working from home. And so I too sort of was smashed down on my Maslow hierarchy in the pandemic, like everyone else working from home. And I thought, well, at least I know how to do this. But the great blessing was what we're doing now. Our ability to connect and have broadband also became a social determinant of health and well-being. And so many women, especially who could not work from home because they were in caregiving jobs in the informal health sector and not knowledge workers, could not do what I still could do. So I started to think about that a lot early in the pandemic, like who is caught out in all of this. At least we who could connect could get healthcare. So let's shift to then this theme we're talking about, which is women's health and healthcare in the pandemic, post-pandemic. What did you learn from the Maven seat, front and center in the pandemic, dealing with women and healthcare in the pandemic?
Yeah, I mean, and you said it well. It was for me personally, I obviously joined the company during the pandemic because I felt so strongly about being able to think about differently in this space and wanted to be part of the solution and bringing it together. And so learned a lot during the pandemic. I mean, I think there are a few key themes that we saw come across, first and foremost, just the need for on-demand access to telehealth throughout all of this became, not a nice to have, it was a necessity to have for individuals to get the information that they needed and access to care and empowerment, frankly, throughout their own journey throughout. We saw a huge impact on a 300% increase in telehealth utilization for mental health, in particular on our platform, because again, the feeling of being alone and not having those traditional resources and, your family members or your friends, or even the ability to go in person to your provider for classes and build community was very much taken away during this entire experience. So learned a lot there. And then really learned also how fragmented things are. So there's a story of a woman named Maria who came to Maven. She was diagnosed with gestational diabetes. It was her third child, actually. So she'd been through pregnancy before, but was told by her provider, you've got gestational diabetes. Your baby might die. You need to make a change in your nutrition. Here's the name of a nutritionist. Go and make the change. And trying to think about that in the environment that we're in, how overwhelming it was. She went to the nutritionist. She couldn't get, she got some information, but she really needed somebody to candidly hold her hand and be that support system throughout all of this. So she came to Maven. She got a nutritionist on demand. That person worked with her every day during the period of her pregnancy, helped her make a difference in her health, and ultimately had a healthy pregnancy as a result of that. But it's just one example, Jane, of how, you kind of don't think about the journey. You have these 8-minute visits once a month with your OB, but during the pandemic, all of that was heightened, both the anxiety levels, the access to information, and the access to the ability to make change was just harder than ever before. And so having the ability to have all of that come together is really what we were able to bring, ultimately trust and engagement to our members, which made a real difference.
Health is really made outside of the healthcare system. And so it's natural. We were pushed back to the home. If we think, pre-World War II and the age of doulas and midwives and having babies at home, right? And so again, we were brought back to the future and learned a lot about what's really possible and doable at home, marrying the high touch with the high tech. So that's what you brought to bear. I mean, the pandemic had these healthcare impacts, but there were these toxic side effects too of mental health, one side effect, which particularly impacted women, and all kinds of data around that. New CVS study about that, their annual survey just came out showing differential mental and behavioral health impacts on women versus men. And then the financial impacts, which are a lot of what I think about, because in America, anyway, in this country, we can't separate the financial from the healthcare, because either you get healthcare through your employer, healthcare insurance through your employer, or you're in heavy Medicaid population, particularly for women's health and maternal health. 1 in 2 babies are born to women who are enrolled in Medicaid in the US. And I don't think a lot of people know that, the importance of Medicaid as an insurer for women and for kids. So we had this financial impact, which again, that stress from the finances impacts our physical and mental health. So women were really hard hit with that. And in the work from home instance, if you could work from home, Sheryl Sandberg early on in May, I think, 2020, talked about moving from the double shift to the double shift for women who were moved to work at home, educating kids at home, had their usual healthcare duties, even though lots of us mate with mates, either men or women, who we share our homes with, who do fill in to do dishes and housework and stuff. But still, as it turned out, women have been the ones who were harder hit in the she-cession coming home. And so that's taken a tremendous toll on mental health. And 1 in 3 women are saying they may be part of what we're looking at in the economics world is the great resignation. 1 in 3 working women may not return to work because of their experience of the last year and a half. And the more endemic this pandemic goes, because we're seeing the Delta variant and all of that, the worse that will hit women ongoing. So I'm afraid I don't have a happy forecast about that.
Yeah, it's a challenge. I mean, I know we also are seeing the 50% of the women who are existing in the real, people, not just women, are potentially looking for new jobs, right? Thinking about their world in a very different way, both from a healthcare perspective as well as an economic perspective. And just it is going to have a huge impact. And so thinking about that very comprehensively is, I think, really important for our society as a whole.
Yeah, indeed. I have been, of course, watching more TV and consuming more media in the shutdown and still staying home a lot. And I know there's this Folgers coffee ad, not to mention a brand, but it's very instructive when you think about the male worker versus the woman worker at home. The male worker in the Folgers ad we see in his boxer shorts. That's the fun part of that ad for him. For the woman, it's keeping her young son, out of the camera lens. She's the one who's got the kid in the kitchen with the Folgers coffee, of course, brewing. And I find that fascinating that even in our pop culture, on the Mad Men of the world and women are still advertising that way. So this is the reality. And you and I both live in the real world here. We think about mental health, behavioral health, and then healthcare access.
Absolutely. Are there other impact or economic impacts that you've thought about or seen in some of the research that you've done?
Yeah, I'm encouraged. So, you and I are optimists, I think, at heart. And the silver lining was the standing up of virtual care and telehealth. And particularly, even though we're seeing telehealth claims inching down lately, we're still seeing the persistence of mental health staying fairly high. And this is a beautiful thing because mental health has been so underserved in the US, and particularly in rural areas and in areas where there have been taboos around taking advantage of mental health services. So now I think that as mental health impacts have been so universal, whether you could work from home or not, anxiety, stress, sleeplessness have impacted lots of people. And so I'm very encouraged by the growth of the use of telehealth overall. And moms have always been interested in telehealth in the pediatric world when faced with needing an appointment on a Saturday night. And of course, the pediatrician hasn't been in. But now for telemental health, I'm really excited about the different flavors and permutations we're seeing for mental health for men and women, rural and urban folks. Even Walmart now began to offer, just before the pandemic, a $60 take-in visit for 60 minutes for your first visit of telemental health, and $45 for your ongoing 45-minute visit. So that's pretty accessible. And we look at Medicaid programs and other value-based payment, bundling in mental health into the benefit, and then employer plans looking very seriously at providing much more mental and financial planning assistance as well as people come back to work. So these are some of the lessons I think that will be baked into healthcare in a positive way going forward.
Yeah, I believe so. I think the other thing that we're really thinking about is that we're starting to see more, and it's really important for us at Maven, and we believe this is like thinking about the beginning of life is that really key moment to make an impact for women and families in our healthcare system. And this goes even to the investment area. So for years, Kate Ryder, our female founder and CEO, when she was talking about women's health, it was kind of a niche vertical. And some of the male investors would say it's interesting, but let me go back and ask my wife whether that's really an issue or a concern. I mean, it was just unheard of the way that it is today. And there's a quote that I think is so important from Herbert Humphrey, which says, "The way we treat our children in the dawn of their lives and the way that we treat our elderly in the twilight of their lives is really the measure of the health of a nation." And when you think about that, and to your point earlier, that 50% of our births are taking place in Medicaid, we've seen such a shift in Medicare, where from elder care perspective, very comprehensive, thoughtful analysis around that, and really surrounding and innovative models, to your point, around value-based care. We really see still so much fragmentation in Medicaid. And so our ability to really dig in there, do something different, shift the system and think not just as a niche vertical around women's health, but really as the entry point to change is really an opportunity, I think, for all of us, and no longer really just a vertical, but a chance to really change and make a real difference in the population going forward.
And that's such an exciting area, looking at the role of value and the continuity of health, starting in prenatal care, being healthy when you get pregnant, and then all the way through your prenatal care, through birth, through childcare. So it does start early, like the circle of life, going back to the beginning of life. But that's really where social determinants of health have their greatest bang for buck when we talk about investment. If you look at prenatal care, education. Sound like Nancy Pelosi when I do that 3 times, but it's true. The bang for buck on early childhood education, and therefore the investment in childcare is so important. That's really high quality childcare that we see in other countries in the world, like Sweden and Northern Europe, and then really all of the OECD countries invest much more in social care than in medical care in terms of the ratio. And in the US, it's inverse. We spend much more on things like brain surgery and very tertiary, quaternary care than we do in that upstream investment, which, to your point about Morocco and early childhood intervention, so important. So yeah, that's where the ROI is if we're just going to be investment minded.
Completely agree. I mean, that investment in the first 1,000 days of life, specifically from conception until the baby's second birthday, really has shown a 35 times X ROI in downstream cost savings. Because again, that is when often women and families have not been engaged in the healthcare system before. It's the first time that they're entering the system. It's the first time they have the ability to really think about, to your point, education, health literacy, all of those components, again, that have such significant downstream impact, and not just on the health of the mother and that family, but generationally, right? If you put those, and that's again, that's what I saw in Morocco in the 2.5 years I was there. But like that first year, if you're able to see it, if they do it for one of their children, they're going to keep doing it for others. And so that has a huge impact on our society. And we still have a ways to go there, unfortunately. You know, we have work to do. It's getting better, but we really have work to do there.
So much work to do. This issue of intergenerational equity and your ability to do better than your parents, it starts then in youth. And there's lots of data coming out of the National Bureau of Economic Research and Brookings looking at intergenerational equity. And in what we're going through now in the US, the K recovery, where wealthier people and people like you and me who could work at home, who have 401ks, have done fairly well in the last year because we had nowhere to spend our money. Now, of course, revenge spending, and that's why airline tickets are so expensive. But on this lower part of the K, where you did not have savings, you did not own your home, you did not have equity in your home, you did not do well, and you're still not doing well. So to your point, getting those investments in, which is something that President Biden's infrastructure plan is talking to directly right now as we're sitting here talking. You know, that's what it's about. It's about catching up with income inequality, which existed before the pandemic, but exacerbated during the pandemic, no doubt.
Yeah, absolutely. And those investments, to your point, that are around childcare and other areas that actually help women get back into the workforce, help families be sustained throughout this transition. And hopefully as, you know, the economy comes back and more jobs are available. But having, again, the access to childcare is a huge issue, right? If you don't have a place to take your child so that you can work and it's in a safe environment in a way that's affordable, that has a huge impact on the economy. And again, is one of the reasons that so many women are dropping out of the workforce, right? It just is really challenging. We saw that also with all the schools. I mean, that was also a challenge, right? I mean, when your kids aren't in school, there's a big chunk of time that you are spending them, right? Like helping them throughout versus actually interacting and being able to be part of the workforce. So yeah, having the right infrastructure in place for our country to allow that to bring women back in and also to contribute again to the health of the nation is really, really core to our long-term financial sustainability.
Yeah, and that's the healthcare spend in America is $1 in $5 now, almost 20% of the national economy. So it's very difficult, in fact, to tease out the infrastructure in terms of hard infrastructure, think of broadband, and soft infrastructure, hard and soft. There's this Venn diagram where they overlap, particularly when it comes to women and caregiving, you know, which feeds into health, the health of a family, the health of a community, the productivity, the economic productivity of a community, the tax base of a community. So there's this continuum where we look at the soft infrastructure being able to fuel the economy. And so we should want to invest that extra dollar in that soft part in terms of childcare and many other parts of social care, education, and elder care too, because women and men are both caregiving for our aging parents and aging friends. And that has a tremendous amount of stress on the individual. My great friend, Alexandra Drain, talks a lot about this in her program called Archangels, which is really looking at caregiver stress and the economic role of people who do this for free. There's a huge economic value that if we remunerated people, we'd up the social care spend in the United States by quite a bit. So yeah, I think this talk right now about infrastructure needs a real come to God moment, if you will, which is what do we mean by infrastructure and what's the ROI on the spend? Because we'll spend less overall over an episode if we've invested upstream in so many of the things you've been talking about, social determinants, education, et cetera.
Yeah, absolutely. Huge Alex fan as well. She's a friend of mine too. She's been a great proponent of thinking about caregiving on a very comprehensive basis for years throughout her career.
That's right.
I think the other way to think about it too is just also when you're thinking about that all paths to parenthood and the journey whether it's through fertility, adoption, surrogacy, but then all the way through pregnancy in the first year of life, and then all the way to parenting and pediatrics. And thinking about that also comprehensively, it's very chopped up now in the way that you think about maternity and disability. We need to think about that in a much more comprehensive basis.
Yeah, and ultimately, as the aging kicks in, boomers start retiring, and we think about Social Security and Medicare, and this is a particular U.S. view. Again, we're going to have many boomers that haven't saved the amount of money they need, not just for living, but for healthcare. So the average couple retiring now, the Employee Benefit Research Institute tells us, needs upwards of $250,000 in the bank account, this liquid savings to pay for what Medicare does not pay for, Part D and other out of pockets. We're going to reach that moment sooner rather than later where Medicare, Social Security, and our kids who have to support us as we age, there aren't as many of them to support us. So there's this perfect storm brewing, separate from the pandemic, but the pandemic worsened it for women who, again, have less money saved for retirement than men do, largely based on not being paid the same in the same job or in jobs that don't pay as well. So we've got another storm coming separate from the pandemic. It's an economic storm that, again, if we plan to be there when the puck gets there, which we've not been so good at in the US, but now I think we're much more aware of a lot of these tensions and challenges that are ahead of us.
Absolutely. So what's the hope for the future, Jane? What's on your wish list?
Yeah, I think it is this, number one, understanding that we're a community, that we are health citizens, and that we have to be here for each other. And I'm hopeful that we will move in this direction. Before the pandemic, I was really focused a lot on that, moving from sort of health consumerism to health citizenship based on what I see in the EU and other parts of the world where people have universal health care, more social spending, and a safety net that protects people from falling through the cracks, where in the US, medical bankruptcy is the #1 source of filing for bankruptcy in the US, which when you travel around the world, as you do, and talk to other people, they wonder, what kind of country is that? You're a rich country, but don't you all love each other? So I'm looking to build that world, and this is part of my mission and my work, is to work with people like Maven Clinic and other places that you've been affiliated with who get this, who know that it takes a village, that we're on a lifeboat, and in the pandemic, if we don't learn this now, then I won't be so optimistic. But right now, we're at a moment where I think we can keep building on what we've learned. So that's my hope. How about you?
Yeah, I mean, I'm an optimist at heart. I want to believe that we will change. And to your point, there'll be a change in the system. And honestly, my wish is that instead of thinking about pregnancy as a disability, which is what we do today, that we really think of it as the ability, the single most important opportunity to improve the health of our society. That precious time at the dawn of life, as I mentioned earlier, that becomes the focal point for our healthcare system. That's ultimately my wish.
I love it. Well, amen and amen to that, sister. And thank you for having this chat with me. I wish we were together in the same room, but the day will come.
The day will come. Thank you so much as well. It's been so fun, and hopefully we can continue the conversation, have more to report in the years to come as well.
And thanks, Bayer G4A, for hosting us today.
Absolutely. Thank you.